Hi guys, Dr. Nicole K. Williams here, Doctor of Chiropractic Medicine, professional speaker, and your health advocate for all things wellness through functional medicine-based approaches. We publish new content weekly, so please hit the red subscribe button below and enable notifications so that you can continue to get the most up-to-date information to get you and keep you looking and feeling your best. Today I want to talk to you about the social isolation that's been recommended by the CDC. To prevent the spread of the coronavirus, COVID-19, or slow down the spread of it. So what social isolation means is basically avoiding large groups of people and crowded environments, which is why we've seen so many cancellations of various activities around the globe. So, kids are now doing homeschooling, people are working from home, they've had to cancel vacations, concerts have been canceled to prevent that congregation of large groups. So by doing that, we can actually slow down the spread of the virus and then give the health professionals time to figure out how to treat this properly and come up with other solutions so that the people who are sick can get treated. So, it's really an interesting time because the world is forcing us to be still. And a lot of people are nervous, they're scared, feels kind of eerie going outside. So how can we flip this and make it more of a positive experience for everybody? So number one thing is we don't want to stress, because when we get stressed out, cortisol hormone goes up, right? And when cortisol hormone goes up, your immune system goes down. And that's exactly what we don't want during this time. So most people are going to be home for at least 2 weeks as far as we know right now. So I want everyone to kind of think about what's one thing that you could do, something that you've been wanting to do for a long time, and you just really haven't had the time to do it. Maybe it could be starting a new business, learning how to sew, learning how to cook. I mean, a lot of people now, we've all seen the grocery stores and what they're like. Maybe you want to explore cooking some healthier meals and teaching your kids to do that. Maybe you've had some health challenges that you've really just kind of been putting on the back burner. Maybe you're pre-diabetic, overweight, you've been wanting to get your nutrition back on track. Or maybe you've been wondering, how can I get off this medication for diabetes and high cholesterol through holistic wellness-based practices? So give it a moment and just really think about one thing that you'd like to change or pay some special attention to over this time of stillness that the world has given us. Now, in practicing social isolation, our office is still open at the time of this recording, and we've taken extra special measures as recommended by the CDC to ensure the safety of our patients. So number one thing is we've asked if you are feeling sick at all, any cough, cold, flu-like symptoms, body aches, you've been sneezing, just stay at home for extra precautionary measures, right? Now, if you are feeling good, we are here to serve you because a lot of our patients are on programs and they depend on us for pain relief and for other things, health guidance and that sort of thing. We are accepting patients by appointment only, and the reason for that is so we can spread out the patients. So you will not be in any sort of social environment in our office. We are also offering telehealth services through a secured HIPAA platform, which ensures your patient privacy. So if you are, at home and you're thinking, I really have some health questions and I want to get my health on better track, I want to make sure my immune system is nice and strong. So if something like this comes around again, I'm not feeling so anxious. We do offer those wellness services through our online platform. So I hope that's helpful, and I hope it eases some of the anxiety. Keep washing your hands, take some time to just be still and reflect. Check on your older friends because, we're finding that this virus is definitely more serious if contracted by people over the age of 70. So, some of my older patients have been isolating themselves at home, which I think is a good idea. And, they're basically not going anywhere or being around anybody. So take a moment and check on them, because I imagine this is a little bit more fearful for that population. So, if it's a grandparent, an older friend, a neighbor, pick up the phone, give them a call, and just, see how they're doing. Thank you so much for watching. I hope you found this information useful. In the meantime, keep washing your hands, keep your hygiene and health practices up. Make sure you're still taking your supplements if you have some. We've got some new shipments coming in towards the end of this week for people who will need to stock up. And start including some leafy green vegetables into your diet. When I went to the grocery store, the frozen section was sold out. Of course, the toilet paper was sold out, but a lot of the fruits and vegetables were still there. So, our best defense is being healthy. And I think when all this is over, or maybe during it, some of you might reflect and say, I really need to get on a healthier plan to, just be healthier overall so I don't feel so fearful and susceptible if and when something like this comes around, or even just, the yearly flu. So we are here for you to help you navigate that and navigate some programs and processes that we use with our patients to make sure that they are getting healthy and staying healthy. So I will see you next week. And until then, remember that it's all about your health above all else.